the room. Cindy recording for Miriam.
Knock, knock, knock. Provide privacy. Wash my hands. Put on my gloves. Hi, my name is Marion. I'll be your nurse today. I'm here to do your physical assessment, if that's okay with you. Okay, beautiful. Could you please, let me look at your tag. Could you confirm your name and date of birth? The patient appears stated age. The face is calm. No sign of distress. Behavior is appropriate. Do you know where you are? Do you know why you're here? Do you know the time? The patient is alert oriented to person, place, time, and situation. Speech is clear. The patient looks well groomed, shaved his beard. The lips is moisturized. The gown is clean and neat. Do you have any pain or any allergies? No? Okay, I've performed patient vital signs and they are all normal according to the patient baseline. I'm going to inspect the patient head for shape and face for symmetry. The head is normocephalic and traumatic. The face is symmetrical. I'm assessing the patient's face for color. It's color is appropriate to ethnicity. The lips is pink and moist. I'm assessing the patient's scalp. The patient's scalp is clean, clear, and intact. The patient has no hair, shaved his head. I'm going to assess the patient's neck. The neck is erect. Could you please push your shoulders up a bit? The shoulders are even. The trachea, substernal notch is in the midline. I'm going to palpate the patient's head. I'm palpating. Do you feel any pain? There's no tenderness, no muscles. I'm palpating patient carotid artery for pulse rate and rhythm. For rhythm rate and strength, it's 60 to 100 beats per minute plus 2. I'm doing it bilaterally. I'm going to palpate the patient lymph nodes. I'm starting with the pre-auricular, post-auricular, occipital, all the way to the back, tonsillar, submandibular, submental. I'm assessing anterior cervical, posterior cervical, supraclavicular. The lymph nodes are non-palpable. I'm going to perform a strength range of motion on the patient neck, assessing the strength. Could you please look to your right, chin down, like this. Look the other way, chin down. The strength is +4. I'm going to assess the patient's eyes. To move closer. The patient eyebrows, the eyelashes are present. The eyelids are clean, dry, and intact. There's no sign of lacrimal drainage. The conjunctiva is clear. The sclera is white. I'm going to put my hand between your eyes and light a torch. Look straight. Okay, I need you to look at this pen and don't turn right or left, just look at it, okay? Follow it. The pupils are equal, round, and reactive to light. I'm going to assess the patient's ears, starting with this ear. The auricle, external auricle, and the lobules, they are clean, dry, and intact, no lesions. I'm pulling up, there is no sign of no drainage. Same this side, I'm looking external auricle, clean, dry, and intact. Up, there's no drainage. Please tell me if you feel any pain. I'm palpating the patient tragus. There's no sign of pain. I'm going to do a whisper test. Tell me if you can hear what I'm saying. The patient can hear my sound clearly. I'm going to assess the patient nose. There's no flaring. The mucosa membrane is pink and moist. There is no sign of bleeding. The sternum, the septum is the midline. I'm going to perform patency bilateral. Could you please blow in and out? This side in and out. The patient nose is patent. There's no sign of blockage. The airways are clear. Please open your mouth for me. I'm looking at the buccal, sublingual mucosa. They're all pink, moist. There's no lesions. The hard palate and soft palate is intact. The teeth is all in there. There's no sign of gum disease. Could you open your mouth wider? The uvula is present. It rises and falls. The tonsils are absent. I'm going to perform respiratory, cardiac, and peripheral vascular assessment. I'm assessing the patient breathing mode. The patient is a mouth breather. I'm assessing, I'm looking at the neck for accessory muscles. There's no sign of labored breathing. I'm looking at intercostal muscles. There's no retraction. I'm assessing patient breathing pattern. When supine, lateral, and sitting upright, the patient this shows no signs of labored breathing. Breathes okay. The patient has no cough, no sputum. I'm going to put the patient slightly down to 30 degrees. I want to assess the jugular vein distension and show JVD. Could you please look the other way? The JVD is flat, no bulginess. This other side. JVD is flat, no bulginess. I'm assessing the patient's chest for shape and symmetry. The chest is symmetrical bilaterally. The shape is 2:1. I'm going to assess the peripheral pulses. I'm starting with the radial pulse. Rate rhythm and strength 60 to 100 beats per minute. Strength is +2. The femoral, rate rhythm and strength 60 to 100 beats per minute, rate +2. Behind the knee, popliteal 60 to 100 beats per minute, +2. Pedial pulse 60 to 100 beats per minute, strength +2. Tibialis posterior 60 to 100 beats per minute, +2. I'm checking capillary refill for the toes bilaterally. It's under 2 seconds. Checking capillary refill bilaterally for the arms under 2 seconds. I'm assessing patient temperature. Patient feels warm. It's evenly distributed. Next, I'm going to start palpitation. I'm palpating the patient's chest. I'm palpating for masses, crepitus, tenderness, which there is none. I'm going to palpate the patient cardiac landmark, right aortic, second intercostal space, left, pulmonic, second intercostal space, ab mid-sternal, third intercostal space, tricuspid, fourth intercostal space, mitral, mid-clavicular, fifth intercostal space. There is no hives or lifts. I'm assessing patient thoracic expansion. Could you please breathe in and out for me? There is no, the thoracic expansion is equal bilateral, no signs of hyper or hypoventilation. I'm going to listen to patient lungs. Patient's lungs are clear. There's no crackles, no wheezing. I've also assessed posteriorly and laterally. I'm going to listen to patient cardiac landmarks. Right, second intercostal space, aortic. Left, second intercostal space, pulmonic. Third intercostal space, ab mid-sternal. Tricuspid, fourth intercostal space. Under the breast, mitral, mid-clavicular. S1 and S2, they are audible, no murmurs. I'm going to assess the patient abdomen and genitalia. The patient abdomen, there's no contours, it's flat, it's symmetrical. The patient has no pigmentation, color is appropriate to ethnicity. Gastric pulsation is light. There is no scars, there is no striae, there is no petechiae, there is no bulginess, no masses. Umbilicus is in the middle. I'm checking the genitalia. The health tissue looks healthy. The color is appropriate to ethnicity. There's no signs of lesions. The hair is evenly distributed. There's no drainage. Urine is yellow. There's no smell. It's around 30 ml. The stool is brown formed and it's moderate. I'm going to listen to auscultate the stomach bowel sounds, all four quadrants. I'm starting with the right lower quadrant, right upper quadrant, left upper quadrant, right lower quadrant. The bowel sounds is normal active. I'm going to do pulsation, all the 9 regions. I'm palpating, there is no tenderness, no masses, no bulginess. I'm going to musculoskeletal assessment. The patient posture is erect. The gait for spasticity, tic and tremors is even and symmetrical. My patient is not using any assistive device. I've performed random test, patient standing up, closing their eyes 30 to 60 seconds. The test is negative. I'm assessing patient skin from upper extremity to lower extremity. The patient's skin color is appropriate to ethnicity. The hair is evenly distributed. Skin tinting. The patient's skin is well hydrated. I'm going to assess patient extremities and joints for shape and tenderness and also edema. Tell me if you feel any pain. There is no tenderness according to the patient. The shape is symmetrical bilaterally. Edema is +1. I'm going to check the patient nails. Bilaterally, I'm checking the patient nails for it's not spoon shaped, there's no clubbing, the color is even to the skin tone. I'm checking the patient's nails. It's not spoon shaped, there's no clubbing, color is even to the skin tone. And I'm going to perform a sense of touch and pain. Please tell me if you can feel this touch and tell me if it's painful, okay? On bilaterally, upper extremity and lower extremity, I'm going to check on the... Do you feel patient sensation is dull and there's no pain? I need you to please grip my hand. I'm assessing for strength. Tighter. Okay, strength is bilaterally, it's equal, is +4. Can you push my hands with your feet? Okay, push up. Strength bilaterally is symmetrical, is +4. I need you to do this for me: circumduction, supination, pronation, supination, flexion, extension, adduction, abduction, adduction. The patient has performed this range of motion and the strength is +4. Do you have any questions? I'm going to leave this call light. Please call me if you need anything at all. I'll be back to check on you in 30 minutes. And have a good day. Thank you. I finished my session.